feel like testosterone replacement therapy and hormone replacement therapy is going to be something that's just kind of all over the mainstream media.
It is, right? It's not as taboo. Even in the past 2 years, it's not as taboo. 5 years ago, you wouldn't talk about it with anybody.
So this is totally legal.
All legal.
Right? There's no scenario here.
All prescription based. All prescription from the doctor. It gets sent right to your house.
When it comes to like the NFL, this is still considered a controlled substance.
It's still a banned substance like the NFL and like UFC, things like that. They can't use it, which I think is kind of a crock.
Screw all that.
Of course, part of that is testosterone hormone replacement therapy.
Still get it up.
Yeah, I mean, I can still get it up.
I love this podcast.
That's awesome.
Hey guys, we're back with season 2 of the Disruption Podcast. I'm so stoked that we have a new malleable set now. Now that Flexwork Studios has officially broken 100,000 subscribers, we felt like it was the right time, right, Ludwig?
Absolutely, man. 100,000 subscribers, who'd have thunk it? In less than a year, I think it's a big milestone for us.
I think I thought it.
You did think it.
Is it really a year? We've been filming Disruption for maybe 2 years.
Dude, it feels like a year. I mean, we've been off for a while, so.
Well, we're back with a big bang. We have a brand new friend, a client, and honestly, an innovator in the space that he's in.
Yeah.
So I would love to introduce everyone to David Lindberg. How's it going, man?
Good. How are you guys? Happy
What's
to
up,
be
buddy?
here. Living the life.
Living the dream.
living the dream on a day-to-day basis.
Well, you live in Vegas.
I do live in Vegas.
Vegas is one of those places where, I mean, if you're a guy disrupting and creating a business, there's definitely some awesome opportunity to happen.
There is.
But Vegas can be a crazy place to live. How does that work?
And like we talked about, I think it was last night, Vegas is not reality
That's
by
for sure.
any means.
Vegas is not real. Yeah.
No. It's a blast. You got to learn to have balance and have some, just get your thoughts about yourself some days.
Yeah. But you're originally from
Colorado,
though. So how did we get from Colorado to Vegas?
Oof. So it's a long story. So do you want the Reader's Digest or like from start to finish on that one? It's a good story.
I mean, we got to start with the dirt mountain bike life.
Oh, the BMX racing
BMX
life.
racing.
Yeah. So started BMX racing. I was like 10 or 11 years old. I was always a heavier set kid, defied the laws of physics, wound up getting my pro card in my, I think I was 17 or 18, got my pro card. Played college football for a little bit, didn't like it. I wound up moving to San Diego and driving around the country in my team and with my sponsor, his team and truck and the trailer, that's traveling the circuit and racing the circuit for about 2 years before I went.
What didn't you like about playing college football?
It was I'm not a kiss ass.
Yeah.
So too many politics for me. So I got tired of it and just wasn't what I thought it was going to be. It was fun. I loved the sport, but
X Games to ESPN2 wasn't the direction you wanted.
Yeah, right.
Yeah. So yeah, went a different direction. Moved to California for about 2 years. Raced on the pro tour. Drove, nationwide, all the nationals, all the races. Had a great time, and then figured I needed to grow up about 2021 and moved back to Colorado, and where I joined the police academy.
Oh wow. So,
But don't you have a brother in the police?
I have a brother he was in the military first, and then he joined he's a federal officer now, stationed out of Liberty State Park. But what made you want to go from BMX?
Wait, hold on, guys. Screw all that. Last night we went out to dinner and we played 3 truths and 2 lies. So he said his brother is an actual police officer,
Yep.
right? But what were the 2 lies that both of you guys told?
I don't even remember. Do you remember what they?
I think one of your lies was that
Oh God!
it was you shot for something. You said you shot
for
for
Playboy.
Yeah.
So, this Boy Scout, no chance. No
Right.
chance.
There was a chance, but no, I did not shoot for Playboy. That would have been
He's
bad.
never even seen a nude woman in his entire life.
That's not true.
But what was the other one? I'm trying to.
I didn't do another lie. I couldn't think of one.
You just stopped at 4. You
Yeah,
couldn't
yeah,
come up
yeah,
with 5,
yeah.
and you just snuck that.
Yeah.
You snuck that out there.
Yeah.
Do you remember what your 2 were?
Yeah.
What were your 2?
The Speedo?
The Speedo's real.
No, we definitely got married in Speedo.
I had it on.
No, literally 2 weeks ago, we're at a video shoot, and we needed a Speedo for one of the guys for one of the shots because he was getting body painted. Everyone was just like, "Does David have an extra Speedo?" Because of course David's gonna have an extra Speedo.
Yeah.
And of course he did. He was like, "I have 3 brand new
God.
ones at the crib." We're like,
Like, what do you need? Here you go. The federal indictment thing.
Oh,
Yeah.
Oh, the federal indictment. That sounded real.
the face you made when he was like, I'm at risk of being federally indicted. It was just like, oh, what's gonna happen?
That's the company Anchor keeps. So I thought it could be real.
At least 2 out of 5 friends are safe.
At least
all times.
those are good odds right there.
Yeah. Can a podcast be tapped?
Yeah.
This is a closed recording studio. I think we're okay.
Yeah,
Oh, it's your Google thing up here. They're tapping that.
Until it hits YouTube. Yeah.
All right, you need to help us solve something else.
What's that?
When is it too early to play Christmas music?
I don't
The
think it's
entire
ever,
crew was arguing about that.
I don't think it's ever too early to play Christmas music.
Really?
So you can play in August?
I've heard it in August.
When
When does Vegas start playing Christmas music?
Year round, there's a Christmas store in Vegas.
Wait, what?
Oh God.
Where's the Christmas store in Vegas?
It's right off the strip. Yeah, there's a Christmas store 24/7.
Just 365.
Yeah,
You could be Santa Claus in the middle of July.
pretty much.
Nah, I'm not cool with that. Stay away from me.
What? I think Costco starts selling Christmas stuff in like September now.
Yeah, but that makes sense, right? Our wives need something to do.
Yeah.
For those that are married, I'm not married, so
Yeah.
anymore.
Well, let's get back into what brought you to Vegas from Denver.
So, cop for about 15 years in Colorado. Went through some bullshit with my agency, planning to be the next chief. The chief at the time wound up throwing me under the bus to save his own career. Can't go into much more detail because of NDAs and everything I got into with the city.
Because that doesn't happen in the police force.
Not at all.
Yeah.
Not at all. They don't try to fuck you over ever.
Right.
You have the brotherhood. They say you're a brother, but they just look out for themselves.
Yeah.
So did that. Got tired of Colorado. Needed something different. And at the time, I was in the process with Las Vegas Metro PD. Found out that MGM properties were hiring or creating a team called the ERT team, which is like an on-site private SWAT team. Somehow that might be kind of interesting going the private route. Got hired with them and became a training manager for them right away. So I pretty much ran the training unit for them for 2 years for MGM properties and the ERT teams. Part of my background is I ran a SWAT team, was a big trainer, did Krav Maga, did all my defensive tactics instructing.
Dave, what
Maga.
what does a SWAT team have to deal with in Vegas? Bomb threats? Like,
So any kind of like active shooter, like a lot of people think that the ERT teams or these emergency response teams in Vegas came about because of 10-1, but they're actually trying to be implemented before punching stuff before the 10-1 event. Unfortunately, they just couldn't get it implemented in time.
is 10-1 when that guy shot at everyone?
Yeah,
at the
when they
concert?
had the mass shooting at the Route 91 concert, whatever it was.
And so you weren't in Vegas for that.
No, I wasn't. I
Okay,
came about a year after that.
So after that, they're like, we need on-site SWAT to deal with.
They
all
were
this
in the
good
process of trying to create it. It just was going through the bureaucracy and trying to get the loopholes of the corporate world, and they couldn't get it up and running in time.
So today, could 10-1 happen again?
Anything's possible, right? If anybody has the mindset to go out and set and have the wherewithal or the capability, right? The 3 pillars, right? The means, the capability, and the access to the weapons. Anybody can try it. But now there's active teams or active things in Vegas or support to help mitigate response time. Because Vegas's response time in Vegas is 7 to 10 minutes, which is a lot of things can happen in 7 to 10 minutes. Now the response time is within 30 seconds.
Oh wow.
Oh, wow.
That's huge.
With all these on-site teams, private SWAT teams that these casinos have. Pretty much every casino in Vegas now has this kind of something like a unit like ERT.
So these are privately owned. This
These
is
are
not
all-
the city of
Nope, these are all operated by the casinos, by the corporations. All either former military, former law enforcement, or some kind of dual background.
Now, not to get into weeds on 10-1, but did the shooter, can someone bring in that amount of equipment into a hotel now without getting noticed? Because he bought whatever.
The short answer is yes, right? It's hard to police that unless you want to have dogs in every bag inspected as you come in. But of course, no one's going to want that.
Yeah.
No one's going to pay the resources. No customer or person coming to the casino is going to want their stuff searched all the damn time.
Yeah. Wow.
So is it possible? Absolutely. Anything's possible.
I mean, you could just hide it in a camera lens.
Right. I guess so.
So
Not a Canon lens, maybe a Sony lens.
not a Canon.
He's a Canon guy. and I'm a
Nobody's
Sony
watching
guy.
for Sony lenses, so yeah, absolutely. People.
I mean, that's also Sony lens. This is legit for sure.
Right.
But yeah, that's what brought me to Vegas. I didn't get hired at Metro. I didn't go that route and took a job with MGM, and it was actually a fun time.
How long were you there?
2 years.
Now, when you were back in Colorado, were you DEA?
No, I worked for 3 different agencies, 2 municipalities, like city police, and then 1 sheriff's department.
Okay.
In that time, I pretty much became certified in a lot of different areas. Like I said, I was a SWAT instructor, firearms instructor, defensive tactics instructor like Krav Maga. I was a DRE, which is drug recognition expert, and an instructor in that, which pretty much I can evaluate somebody and know exactly what they're under the influence of.
Oh, wow.
How quickly could you take down everyone in this room?
Pretty quick. No, just messing. Probably not that fast.
He's like 2 minutes. Everyone would be down.
So yeah, the nice thing that with the work in the narcotics and the drug stuff is only 1% of the cops in the world have that kind of certification.
That's crazy.
So it's
Now, Colorado, famously known for marijuana as probably the biggest drug out there or whatever, and one of the first states to go to legalize marijuana. What kind of drugs were you faced with? Is there like one particular drug that?
So where I was, a lot of it was methamphetamine and heroin.
Mm.
So after the 2012 opioid pandemic, when the government decided to stop letting people get opioids from their doctors, of course, what happens? These people addicted to opioids, they cut them cold off. Where do they go to? Heroin.
Mm.
Heroin has a short half-life. So what people would do, they would speedball that with meth, right? To stop having the withdrawals. So the big heroin and meth problem.
And you were trained in being able to pick that up?
Yep.
Pulling people over?
Pulling people over. I was a big DUI guy, driving under the influence. I ran a unit, the town I work for, 1 year got a special award because of how much enforcement we did or how much we did to stop driving under the influence.
Jesus. That's crazy.
So how did you get introduced to the businesses that you operate now? Because you're the CEO of some really innovative stuff that's happening in Vegas.
I am. I got lucky. I've been in bodybuilding for 15 years now.
Same with Ludwig.
Yeah. Nice. So yeah, always been into fitness, being a cop, always into fitness, taking health, your health to the max. And of course, part of that is testosterone, hormone replacement therapy, testosterone. So early on in my mid-20s, I got a prescription for it, wound up going through a clinic out of Florida. When I moved to Vegas, one of my buddies opened his own clinic in Colorado, wound up franchising it in Vegas. That kind of went awry. I was kind of the face of it at the time. So I had a bunch of patients that necessarily didn't get screwed over, but they didn't get their meds in time. They were missing meds. So I got really lucky. I had another buddy in Denver that opened up a clinic. He's like, hey, come be an independent contractor for me, bring all those patients over to us. So we created a contract. If I did X amount of revenue for 3 months, they would give me a franchise, offer me a franchise. I killed it within a month and a half. I was doing over $60K a month. Just because of the influence I had a lot of fitness people on board with me. So right away, they couldn't sustain a franchise for me. So we did a license agreement. Wound up signing some pretty big name coaches, some big athletes under my clinic. And within 6 months, I bought my license agreement out. So it was my own clinic. Had a business partner at the time. And we created Magnus Medical, which was sustainable, which was really good. We grew it to about 2,000 patients in a year.
Oh, wow.
Unfortunately, me and my business partner had a falling out.
Wait, can we talk about 2,000 patients in a year? Is that like a small clinic? Is that a large clinic?
For telehealth, that's a fairly large clinic.
Okay.
We're doing a lot of volume.
And everyone's in Vegas? Or
no, it's telehealth. It's all 50 states. So we're able to service all 50 states, ship to all 50 states, licensing with or partnering with different compounding pharmacies to ship to these patients directly to their door. So I think nice thing about telehealth, it's very discreet, very easy. That's what people, ever since COVID, people wanted things easy access. They don't want to leave their house. They want to do it all from home.
Yep.
And so this is all testosterone, hormone.
It's all testosterone, hormone, sexual well-being, the GLPs, weight
you still
loss.
have access to the call logs?
What's that?
Could we see if Ludwig called?
Yeah, absolutely. Yeah. And then of course, peptides, we're in there as well, but I didn't know much about peptides when I first started it. And we'll get into more of that later.
So how do you get 2,000 telehealth customers? Because what year was this?
This was 2022 is when I opened.
So this is post-COVID.
Post-COVID, I opened in March.
So telehealth was kind of the thing at this point,
right?
No
it was
one
kind
leaving
of
their house. They were talking to doctors on Zoom and all that stuff anyway.
It was very, very popular.
Okay.
So I got lucky because I had access to some big coaches, some big teams in the fitness industry. But I found out early on, not to diss the fitness industry, but they're very cheap.
Coaches or the actual
athletes?
Okay.
They spend a lot of money competing, but they don't want to spend a lot of money on their health.
Mm.
So one of the other reasons I got into it as well is about the time you probably remember all these bodybuilders and athletes were dying.
Right. When everyone was figuring out the liver failure situation.
Yes. So that was a big concern. And a lot of them, I knew quite a few of them, and a couple of them had prior issues that if they would have checked their labs or gone checked, it could have been preventable. So part of my thing, what I want to do is provide knowledge and education. Right? If these people don't know, and a lot of these athletes listen to their coaches blindly and put stuff in their body that they have no idea what it's doing.
Yeah.
So my biggest thing is wanting to have an education and a knowledge background. Make sure these people know what they're doing and doing it safe and understanding the why behind it.
Yeah. Now, mind you, we're not attacking the entire bodybuilding industry, right?
No.
Because there's some great coaches who actually force you to get your labs done.
Absolutely.
And give you great guidance and so on and so forth. There's just those outliers that I'm sure you think the same thing that we do. Like, it never had to it didn't have to happen this way.
No.
Right? So, I mean, you're on testosterone.
Clearly. Yes.
Okay. We're not on testosterone.
No, we're not.
We need to get some blood work done.
Yeah.
How does anyone at home even get their blood work done to figure out whether they need testosterone?
So it's easy, right? Like with my clinic, you hit up myself or one of my patient care specialists. We send you to the website.
Love it. Put your phone away. Not during the podcast.
So now my clinic's called Rejuvenate You. So we send them the website. I send a link to the website. Fill out the intake form. As soon as we get it back, hey, send you labs. I think $250 now. Very cheap, very reasonable price for a full hormone panel, everything. We do the lab order, either to Quest or LabCorp. Send the patient to Quest or LabCorp.
There's LabCorps everywhere.
There's
LabCorp.
LabCorp.
There's literally one up the street.
Yeah, you can throw a rock and hit it.
Okay.
You go to LabCorp, we get results back within 24 hours, which is very easy, right? They don't have to leave their house. Well, they leave their house for a little bit, but even now, there's people flat bottoms that will drive to your house for like an extra $25.
So I feel like I've seen TikToks where like they do this lab work, but they're taking like 20 vials of blood. Why do they take so many vials of blood?
It depends on what labs you want ran and how intensive you want to be ran. Like mine, I think it's 3 vials of blood that we take.
Okay.
It's not much, but yeah, there are certain tests that take certain types of, amounts of blood. Has to be.
Oh, I get it. So like if I want to like, give me the whole book, give me every single thing that test possible, they need more blood. Right?
Probably like, 10, 11 vials. Yeah. But if we're looking for this for certain things, we're looking for certain different markers. We want a clear picture. You can get a lot of results off of three different vials of blood.
Okay. And so then once you see the test results and everything, now you can give a patient recommendations. Does a doctor have to do it?
Yeah. So the labs come back, we get them scheduled for a consultation, either Zoom or over the phone with one of our providers, either a doctor, a PA, or a nurse practitioner that specializes in functional health. From there, they read the labs, right? The labs are just a piece of the puzzle, right?
Mm.
It's all ranges or numbers, but that's just a piece. The other side of it is subjective on how the patient is feeling. So it's twofold. A lot of these Western medicine, that's the issue with Western medicine. These doctors are like, and insurance, like, oh, you're in range. Let's say the range of testosterone for man is like 2-something to 900.
Yeah. Ludwig, how are you feeling?
I feel great.
Yeah?
It's probably because of the Celsius.
So there's no concerns? You can still get it up?
Yeah, I can still get it up.
I love this podcast.
That's awesome. I love it. So,
hey, we're both 40. Okay, so this is a very easy conversation for you to throw in your direction.
Yeah. No, I'm good. I'm good. Thanks for your
Ludwig
concern.
being the only one successful at kids so far. I got one on the way, but
yeah, man, I'm a one shot, one kill type of guy. Like,
okay,
happy for you. Good for you.
So, with this idea that you can get on hormone replacement therapy, or you can kind of figure out like if your levels are low, which I mean they're talking about all over the news and TikTok, where they'll say that like kids now that are teenagers are having low levels of test.
Yeah, I've even seen it in the labs that come back in kids in their 20s, right? Because before, these hormone replacement clinics were like, oh, if you're over 30, come get checked. Now I have people coming in my clinic, or I've seen other clinics that have mid 20s, early 20s, and these kids are coming back with like 200 sub testosterone.
Wow.
Which it's subjective, right? It could be high for that person, but normally it's not. And it's all because of the foods we're eating, the environments we're in, things like that. It's not like it was back when we were growing up, or even before that, to where it's the culture and the environment and the types of foods they're eating that are lowering testosterone.
We just got to get back to mac and dog. If we can get back to mac and dog as like a food staple in everyone's diet, we'd be okay.
What's mac and dog?
Stop it. You grew up here in the Northeast.
Mac and cheese?
Kraft macaroni and cheese.
And hot dogs.
Hot dogs cut up that you put in. So
That
you
sounds
get some protein.
delicious.
Or like
Yeah,
beanies
yeah.
and weenies, like hot dogs and like beans.
I've never even had beanies and weenies. What is that? Yo, I haven't lived. What is this?
It's like barbecue beans, right?
Yeah.
And hot dogs.
And hot dogs.
Yeah.
I don't think that was an option for me growing up, barbecue beans. All I ever had was like straight up Indian like dal, which is like, you know, what you would have at an Indian restaurant when they give you the lentils and things like that. So I don't know, man. I see all this stuff popping up in the news now. I feel like testosterone replacement therapy and hormone replacement therapy is going to be something that's just kind of all over the mainstream media.
It is, right? It's not as taboo. Even in the past 2 years, it's not as taboo. 5 years ago, you wouldn't talk about it with anybody.
So this is totally legal.
All legal.
Right? There's no scenario here.
All prescription based. All prescription from the doctor. Get sent right to your house. All legal.
Has it always been legal? Like, was there a scenario like prohibition with alcohol that you had to like be secretive
No,
about
right?
it?
Like in the 90s, there was the issue with the testosterone issue or the steroid issue. But no, testosterone in the 80s, testosterone was legal. Then in the 90s, they put it on the controlled substance list, on the DEA control list. So you can get it through a doctor and be totally fine.
So can you take too much testosterone?
No. Well, you can always take too much something, but can you overdose on it? No, you can't overdose on
So
it.
you can't just say take a whole vial, turn into the Hulk?
No, the risk of dying, the risk of having adverse reactions is very minimal.
Okay, so testosterone's not steroids.
Testosterone is a steroid.
It is a steroid, okay.
But the likelihood of dying from it is you can't overdose on it. It's not like an opioid where you can take too much and die on it.
What's an acceptable range for your testosterone? Where should you be? Just
Ludwig got really interested. He needs.
I like to keep my patients over 1,000.
Okay.
That's usually where we find the best results, but subjective, right? Like we run the labs, we put them on test, follow up with them, see how they're feeling. But yeah, usually it's over 1,000.
So sub 200. You mentioned sub 200 before.
Yeah.
That's really off.
That's really off.
Got it.
So anywhere from 900 to like 1,500 is like an ideal range.
What were our numbers back when we were teenagers?
Who knows? We didn't get tested.
But like a average teenager.
Probably like 600-700 or higher, or 900.
Okay, so when you were like a teenager and just horny as hell, and
probably like 900, 800, 900.
Okay.
All right. So now you want to keep me at 1,000. What's the protocol? Once a day shot, once a week shot?
No, so the estrogen, it's all about the ester, right? So a lot of these doctors before, these Western medicine doctors, or when you're getting it from your endocrinologist, whoever you're getting it from, like, hey, let's take 40 milligrams once every 14 days. But that's not being educated or knowledge in it, right? The ester of testosterone cypionate is 7 days. So if you're doing a one shot a week, you're getting these big peaks and these big valleys. That's why I recommend, or my doctors and a lot of places recommend, breaking up to 2 shots a week. So if you're taking 200 milligrams a week, which is 1 cc or 1 milliliter, break it into 2 shots like Monday, Thursday, so you don't get these big peaks and valleys, so you have a good constant.
So 2 shots a week forever. And, we get this question, what happens if I come off? What's going to happen? You go right back to where you were.
Where do you take the shot?
You can do it, intramuscular, or you can do it sub-Q, depending on the volume. A lot of females do it sub-Q.
Let's explain what that is to the regular.
Yeah. So IM is intramuscular. So like any type of longer needle in your glutes, your delts, your quads. Sub-Q is subcutaneous, which is just under the skin, like a diabetic would take insulin, like in their belly.
Okay. And you can take testosterone anywhere.
Yeah.
Okay. Good to know. We don't have to actually put it in a weird spot.
Right.
Yeah. So a lot of females we have do sub-Q in their belly because it's easier for them.
Females. I thought testosterone was a guy thing.
It's for females too. A lot of people don't realize females produce testosterone that's on a lot lower basis, but they still need it. And a lot of females are low on testosterone, so we optimize that, especially females that are postmenopausal.
So what happens when a woman takes testosterone? Like what changes can they expect?
So same thing like men, right? Libido, energy, fat, having, fat loss or fat gain, just overall cognitive functioning with their brain, mental cognitive, and just, the heart benefits of it. Before everybody's like, oh, testosterone's going to cause heart issues. Actually, there's studies out there that say testosterone actually decreases your chance of heart disease.
I'm fascinated by your ability, your knowledge on this. Like, obviously, you're being like X Games type of guy. Then you get into law enforcement. Where did this thirst for knowledge come from?
I've always had a passion.
This is all science.
I had a passion for it. I'm not a doctor by any means. I just found this really interesting. And at the time when these fitness people were passing away and dying, I wanted to be educated in it. And with me taking it anyways, I like anything about my body. I just don't take it arbitrarily. I like to do the research, understand the why behind it and what it's doing and why I'm putting it in my body.
Right.
So I did a lot of research beforehand. And when I was competing in bodybuilding, on the type of supplements I was putting in my body. So I understood what was going to happen. And I like being a guinea pig when it comes to testosterone and peptides. I understand what the clinical said, the books say it's going to do, but you really don't know until you put it in your body, see how you react to it.
Okay, so you got these 2,000 patients, and you did that within 1 year, and you're just crushing it.
Yep.
And so you're looking to restart this whole idea with clinics, and like that was a business that's no longer functioning right now.
Correct.
Okay, so is there a new clinic?
There's a
you're
new clinic.
starting?
So yeah, there's a couple things going on right now. I have a new clinic called Rejuvenate You that I partnered with one of my buddies in Colorado that I'm working, that I transferred patients over to there to work that. And then I'm also launching my own peptide brand. And then I'm also going to be launching a consulting business, teaching people how to launch their own hormone clinics and peptide clinics, pretty much like in a box, like a cookie cutter type thing. Give it to them, boom, start their clinic, and give them the resources to have a functioning hormone replacement clinic, a telehealth hormone replacement clinic.
I guess if you're a doctor, like there's not that many resources out there for how to get your clinic set up.
This was the biggest thing. Like for the longest time, it was hard to break into this world, right? Because the hardest thing was finding compounding pharmacies, finding doctors, providers that even understood how to prescribe it, and getting access to these places all in one, right? You might be able to find one very easy, but finding the other one was hard. It's getting these to combine and mesh together to make it work.
Why are compounding pharmacies so selective?
They're not necessarily selective. It's the regulations behind it and the doctors knowing how to prescribe it. The compounding pharmacies know what they're doing, but having doctors that understand compounding pharmacies instead of sending it to like your Walgreens or your Smiths, compounding pharmacies can be great, right? Because they can do things that normal pharmacies can't do, make specialty, medications. At the same time, they can make other things that normal pharmacies, Eli Lilly, these big manufacturers can't do. So it's kind of it's a blessing to have compounding pharmacies, on your side.
Okay, let's get into some deep science. How does someone make testosterone?
How do they make it?
Are they just like taking your arm off, squeezing it, and there's like testosterone juice comes
Pretty
out
much,
of
yeah,
it?
that's
Like,
my oil.
how
Yeah.
does this happen? Is there like a gorilla?
Where's it coming from?
Is Harambe like just getting squeezed once a day?
Pretty much, right? All the raws come out of one place, China, India,
Oh, that's great. Yeah.
So that's where all the raws come from. A lot of
Yeah,
people.
I read some wild statistic that 40% of the raw ingredients for all of this stuff comes from India now.
That's crazy.
And the reason that is because the regulations on manufacturing in the United States is too strict.
Mm.
And the byproduct is a lot of waste.
Mm.
So in India, China, the rules aren't as strict as America. So all these pharmaceutical companies buy these raws and they export them to the United States. So all the raws for any kind of medication are coming from overseas.
Okay. And so, I mean, that's no different than getting powdered garlic from any one of these overseas spots. Versus
Correct.
getting it from America. And this stuff isn't like grown on a farm.
No, it's all manufactured,
Okay.
licensed manufacturing companies, right?
So we're not affecting the farmers.
Not affecting the farmers. And I think there's 2 or 3 big kind of, what would you call them? Not marketers, but like people that deal in that.
Anchors?
What's that?
Anchors?
Anchors, like anchors, yeah. Like that deal in that specifically sell to compounding pharmacies. So big, distributors. There's only like 2 or 3 big distributors of these compounding, of the raws that will sell to, that have these licenses to sell to these compounding pharmacies to make it. Or these big manufacturers like Eli Lilly or whatever it is.
We call them war dogs.
So
Oh, no one got that joke. Okay.
War Dogs, like, yeah, that's a great movie.
I can't hit them all. You know?
That's a great movie, by the way.
Ludwig never saw it.
yeah,
Clearly
of course I
that's the
saw it. This guy. So I have a question about like right now. I feel like we're in the wild west of the peptide space where all these companies are popping up, all these clinics, and it's hard to kind of differentiate which ones are quality and which ones are not. And I think that's obviously an issue. I was speaking to my brother, the police officer, and he's 50, and we're talking about peptides, and he's listing off different websites where he's gone to research stuff. How do you know? That's
a hard thing, right? Like the hormone clinics, there's places that pop up 2 to 3 months, try to make, as much money as they can. They get shut down. Post COVID, everybody was relying on COVID mandates, COVID rules, which was very lax and very open. Now the government's trying to catch up to it, and all these, and there's a lot more clinics popping up now. And that's the problem. You do your research, because a lot of these clinics will just say, yeah, I give you what you want. They're not qualified. They don't have the proper doctors. They don't, but they have access to these 2 things. So like they'll be open 6, 7 months, and all of a sudden they'll disappear.
Right.
So I'm guessing, if I had to take an educated guess, like the top 3 reasons these clinics end up getting shutting down is because their record keeping wasn't compliant, because it's so crazy how much compliance is required in record keeping, patient data being considered safe, secure.
Yeah.
Credit card
The
processing
HIPAA
has to be
violation. Yeah. HIPAA
different
rules.
from how like patient files are being kept. And I'm sure the technology just doesn't exist, right? To put them all in one place.
No, it's a lot of manual inputting. There's a lot of manual
Yeah.
labor that goes into running a hormone replacement.
It's like when you go to just
telehealth.
get like a regular checkup from your doctor, you still have to fill out that form.
Mhm.
And it's like,
Yeah.
you guys have my information. I gave it to ZocDoc.
And to do it right, it's not cheap. I spent hundreds of thousands of dollars on attorneys trying to create my own EHR system. So if you're doing to do it right, it's not cheap.
So that's probably the number one reason why these spots get
Right,
shut down.
compliance
They get an
issues.
audit and someone shows
Yeah.
up
The
with
board-
glasses and like
the Board of Pharmacy
pocket
shows-
square.
Yeah.
The Board of Pharmacy shows up, some kind of regulatory board shows
Yeah.
up. They're not in compliance. They're providing medications, or their doctors aren't licensed in their states they're sending medications to. Just usually more or less is compliance issues.
And then I'm guessing the second one is like someone worked with the compound pharmacy that didn't have their ducks in a row, right? And someone looks up whether this compound pharmacy is still around or not around. Or whatever
Right.
the
And the compounding
situation is.
pharmacies, are regulated, but they're, you've heard horror stories about the compounding pharmacies, are not being completely sterile, things like that. So
What I've heard more of, at least what I think, because I can't really tell what's a hormone pharmacy versus a peptide pharmacy, is that there's some locations out there that'll have in one building, they're manufacturing 17 different things, but in reality, they're only supposed to be manufacturing 2 things in that building.
it depends what they're licensed for.
Right. But because it's, the machines or the staff, it's expensive to have staff in every building or however it needs to happen. I mean, I just heard about this one compound pharmacy in New York that had to get shut down because they were doing this situation where they had all the buildings, but when you went to building number 2, it was empty.
Yeah.
It was all in building 1 for cost efficiency. And like, that's not supposed to happen.
Well, that too. And they're supposed to, if they're doing one product, then they're supposed to tear it down, clean it, desanitize it,
Yeah.
and then get ready for the next product. A lot of these places are not necessarily cheap, but they don't want to spend that money or that time. So they just roll around to something else and they have cross contamination, and they're not completely up to par with standards.
So different supplements,
Right.
right? When you're able to start using like cannabis in supplements, and how it had to be an entirely different building. When they have quality control come in and do cleans, there's like quality control clean level 1, level 2, level 3. And it'd be like if there's nuts in the formula, then you have to have a 3-level clean, which took 6 hours,
Right.
right? And that's just crazy, right? Your machines go down for 6 hours. That could cost you $10,000-$50,000 in production time. So
how do you know? How do you know if you're dealing with
well, do you want to know from a consumer's perspective?
from a consumer for sure?
Do your research. Any clinic you work with, they should be able to tell you which compounding pharmacies are working with. It shouldn't be a secret, right?
Okay.
I'm all for being transparent as much as possible, because the more knowledge I can give them to make them feel safe and comfortable, I have no problem telling them, hey, we're getting it from X compounding pharmacy, or these peptides are coming from here,
Yeah.
right? So they know. So if they want to go look it up, they can go look it up, right? And I do my due diligence when I'm signing these compounding pharmacies on for myself. Is I do the research. I usually go to the facility, tour it myself, and look at it and make sure it's up to par for my standard. If I'm going to put something in my body, I want to make sure that it's safe and clean and everything's good to go.
So I'm guessing there's got to be some like logo certification, something, right? I know in supplements there's this thing called GMP,
Right.
where if you see that on the manufacturer's website, at least you know that they had a license
Yeah.
from someone that came and did an audit.
Usually, the FDA comes in, does an audit, every quarter, 4 times a year to these compounding pharmacies. They have their certificates of compliance with the FDA. So you look for that. You ask them for that. You ask them their COAs, testing the raws and the purity of it. There's still things like that you ask for.
I guess on a consumer's perspective, if the clinic is being shady about where this product is coming from, you should
Right.
probably not
Yeah.
at that clinic.
Right.
Now-
Or they don't being transparent with you, or they, it just seems too good to be true. If they're offering you like 600 mgs of testosterone a week,
Yeah.
100 milligrams of Anavar a day, or whatever it is, it's probably too good to be true.
Okay, well, let's talk about like price fluctuations. I mean, when semaglutide came out and was all over the internet, I remember finding it for $20. I remember finding it for $1,000. Like, why is there such a discrepancy in price?
So the one, the biggest thing is if it's the commercially available, like Ozempic, because the active ingredient in Ozempic is semaglutide, right? There was a shortage of it, so that's why compounding pharmacies got the go-ahead to start manufacturing it back in 2022, 2023. So it was on the shortage list. So if you don't know what the shortage list is, the FDA puts out a shortage list saying, hey, these vendors or these manufacturers, these commercial available manufacturers can't keep up with the demand. So we're allowing compounding pharmacies to start compounding this product. because it's patented. So that happened with semaglutide or Ozempic. And they were able to sell it for a much cheaper price, right? Because you're paying, let's say you're paying for a Ferrari, right? For Ozempic is like the Ferrari. So you're paying top dollar. But a compounding pharmacy is doing it for a lot cheaper. So it's like buying a Honda. Still the same product, still really good. But it's just the cost of it. And of course, you know, Big Pharma wants to make their money. And does it cost that much to make? No. In Europe, you can go buy Ozempic for pennies on the dollar.
So there's some commercialization, and that's what's causing the price difference. I was always worried that, you know, someone's grabbing this stuff from like a third world country and reselling it here.
No, what you got to watch out for, because, you know, Ozempic or semaglutide is still considered a peptide, right? GLPs. So yeah, you have these Chinese companies that come over, these research chemical websites for peptides that sell it for pennies on the dollar, but you don't know what you're getting. It's not regulated. It's not, you know, manufactured in FDA approved, you know, compounding pharmacy, or even, you know, with the FDA approved kind of equipment, right? That some of these other peptide companies are doing, where they're above board, actually above, you know, they hold themselves to a higher standard than the FDA does. That's a lot better quality.
Is it safe to say that if I'm a consumer and I find a website and I want to purchase something that's a peptide or something I'm sticking into my body, they should be requiring my blood before they prescribe? Yeah.
No, not peptides.
Okay.
Because peptides aren't as regulated, and it's a short amino acid chain in your body that already produces. So it's non-hormonal. So it's not going to really affect your hormone levels. Now, if you're looking to get like testosterone or controlled or thyroid medications, things like that, then yeah, you absolutely should be doing your labs beforehand to get a picture before and then a picture afterwards to see where it's at.
So if I find a website that's like, yeah, we'll send you without knowing or without prescription, that's a problem.
Absolutely.
Got it.
Is that website, does it exist? Can you like text me the link later?
Yeah, I'll text you.
Right.
So where do you see this industry going? Because, I mean, you had an opportunity to enter the space. You disrupted, right? You crushed it to the point where they're like, we can't even give you a franchise, right? You're hiding my own clinic.
Too fast, yeah. You know, I helped, you know, help several people launch their own clinics, right? You know, people that were in my own space. You know, you've had that before with businesses where people think they do it better. So I've, you know, pretty much gave people the golden ticket into this, like 3 or 4 people.
Yeah.
Which I'm not bitter about. It just, people take advantage of people. So I think this space is going to become more heavily regulated with the control side of it, testosterone, things like that, just because it's taken the government 4 years now to trying to catch back up to COVID mandates. And they're still in effect until November 2025. So we don't know what the DEA is going to do this year or next year, if they're going to make it stricter. Because, of course, during COVID, you know, there was an Adderall issue where people were being overprescribed Adderall. Now there's an Adderall shortage. So now these telehealth clinics are being slapped on the hand for they can't prescribe Adderall or control substances that are in the category 2. Testosterone is a Schedule 3, which makes it easier to get, but still, I think my honest opinion is either Board of Pharmacy or the DEA or the FDA is going to make telehealth a little more stringent to try to prevent these fly-by-night clinics from popping up. Which, right, this makes it more of a burden for the people doing it right, so it's going to cost us more money.
So, I mean, one of the arguments is like, why aren't we fixing the food supply? Why aren't we fixing all these other things that be preventative from us needing these peptides to begin with?
I think it's going to happen, right, with the RFK in there and the peptide movement that's going on now. I think it's going to get better. You know, right now these peptides are on these category 2 list, but should they be? No, but Big Pharma doesn't want them out there because instead of masking issues, they cure. And they fix.
You know, we can't talk about Big Pharma on the podcast. The whole show is going to get canceled.
Right, my bad. My bad.
Our show's done.
My bad.
One episode is over.
I hear them pulling up outside.
Yeah, my bad. You know, that's the biggest thing at the peptide community right now, right? I had the opportunity to hang out and be associated with some of the biggest peptide innovators in the world right now. And I've always been a big peptide fan. Ever since I learned about them a few years back, I've gone down rabbit holes with peptides, and I'm a firm believer in it. That's why one of my other ventures now I'm doing is launching my own peptide brand, so I can help get the word out there and spread, you know, the knowledge of what peptides can do.
One of the things we haven't talked about yet is really the downside of testosterone replacement or even peptides, right?
There is no downside.
It's almost like, that's the whole thing, right? It seems too good to be true, like these magic.
You know,
it's like, what's the downside of ice cream? There's no downside of ice cream.
Not for you, right?
There's always a risk, right? With anything you put in your body, especially hormones like testosterone.
Yeah.
But the benefits outweigh the risk of it. Right? For so long in Western medicine, we're saying, oh, testosterone is bad for you. It's going to cause heart disease, it's going to heart failure, thicken your blood. It's going to cause all these things. But in reality, the studies that have come out saying testosterone is actually very safe and very healthy for you to use, and people should be on it on a optimization dose. It's helping with heart health, heart with cognitive thinking, fat loss, keeping people healthy. One of the biggest issues with testosterone is it can thicken your blood. So yeah, every 6 months or so, you should go and do a therapeutic phlebotomy or donate blood. You got to watch your PSA, your prostate, things like that. But in all the years I've been doing it, I have never had anybody have any issues with their prostate or any issues or any kind of illnesses or any kind of diseases or any kind of issues related to hormone replacement therapy.
Okay.
Look, I want to be nice. You go ahead.
When it comes to like the NFL, this is still considered a controlled substance?
It's still a banned substance like the NFL and like UFC, things like that. They can't use it, which I think is kind of a crock. Because, right, these guys are performing at their best, right? Or they're practicing and they can't recover as fast as they should be, especially fighters, right? They go through camp and 99% of fighters that go through their camps aren't healthy at the end of it. So they're going into their fights not healthy. If they could be something, if they can create a range or a ratio or allow them to have peptides, certain peptides, to get them through their camp or get them through the season healthy, it would extend their life, extend their careers and their lives, to be honest.
Do you think we're headed in that direction where NFL and UFC would allow it?
Wait, answer this to me. How do they even know that someone is taking testosterone? Like, do they take like a blood test?
Labs, you can in a blood test, you can show the synthetic testosterone.
But can't you just be like, nah, man, I got a lot of natural testosterone?
Yeah, no, because if you run your free test and your total test, they're going to show there's going to be a big difference, and it will be synthetic.
What is free test versus total test?
So your free test is what your body naturally produces, and your total test is what you have going on throughout your whole body. So
the numbers should be like even?
Not even. Free test is always going to be lower. Total test is always going to be higher.
But not much, not if you have synthetic test, then it's going to be much higher. And that's how they know.
Yeah. Then the ratios, right? They're going to show by ratios. And you can also run tests to show that it's synthetic in your body very easily. Now, for peptides are harder to test for, right? Unless it's like IGF, right? Then you can test your IGF-1 levels, things like that. But other peptides, it's an amino acid. So I really don't know how they test for, how they could test for some of these peptides that are out.
So if you're using a peptide to, help with your...
Wait, can we come back to your brother? So is your brother on peptides?
No, he's looking into it though, because he's had some injuries and knee injuries specifically where he wants to use peptides to help recover and regrow his cartilage.
What I want to know is, did Ludwig bring it up to his brother, or did the brother bring it up to he was like, baby bro, what do you know about peptides, man?
He brought it up to me because he saw us
posting about peptides and so on and so forth. Look at that.
So
was that a good feeling?
It's a great feeling. The word's getting out, and we're demystifying this whole, peptide, anti-peptide movement.
So, of all the people that you have now been introduced to, who are you going to introduce your brother to?
Hopefully Dave will be the first person because he's coming back, and we're going to do some content, and I think that would be a great start.
So current cop,
ex-cop, current
full reunion.
Yeah, law enforcement, bonding, and then Trevor.
How does your brother feel about the election that just happened?
I haven't spoken to him about it. What, in New York?
Yeah.
Haven't spoken to him about it yet. But he's a Jersey resident, so it doesn't matter.
Oh, it doesn't matter. But he's NYPD.
He's not. No, he's a federal officer, so he works for the United States government.
Okay. Oh, boy.
Bruh.
They're definitely going to turn the face I just made into a
Yeah. So, yeah.
Wait, so when I got a parking ticket, why didn't you offer your brother's help?
It's not municipal, right? He again.
I don't understand how this whole system works.
Yeah. When you get indicted, which is coming down a federal indictment, when that comes.
2 out of 5, okay? 2 out of 5 of my contacts are safe.
That's it.
Okay, so when I get federally indicted is when I need to call.
That's when I call my brother and see what we can do.
Yeah. So, Dave, when it comes to talking about all this stuff on the internet, because telehealth is through internet, right?
Yep.
I mean, why is it that most of the marketing that's out there is so generic? I feel like the story that you just told us, and like for the past 3 months, we've been hearing all these stories of people who've been recovered, healed. I had someone who his mother was sick, and he literally cured her multiple times. And I mean, these are just amazing, phenomenal stories, but like no one talks about it.
I think people are afraid, or these clinics are afraid to put out information that will be deemed as misguided information, because you can't say it's going to cure you. You can't tell promises that it's going to do something, right? You can say, this is what it's done for me, or this is what it can do, possibility, but you can't do guarantees. And I think a lot of these clinics are going off advice of their counsel, or just afraid to disrupt the social norm and go against the grain.
I don't know. I just feel like if I was a parent, I mean, I'm going to be a parent soon, and like if something happened to the kid, I know how clinical trials work. There's no guarantee that you're going to get this new innovative drug that's out there. You're probably going to get a placebo, right? Chances are 50-50, right? Who gets placebo, who gets the actual drug. You don't even know if the drug's going to work.
Right.
But then you see something like this peptide stuff and you know, all these other therapies that are out there, and they're available to you. All right. And I don't know, man. I'm trying to understand.
I think it also comes down to Big Pharma trying to censor.
We just talked about, we can't talk about Big Pharma.
There's
Voldemort. When Voldemort
Voldemort
wants to censor.
There's certain agencies, there's certain entities that want to censor certain information being put out.
So in your 15 years as a cop wearing the badge, were there some things that you saw that like, we got to censor this, we can't talk about this?
I can talk about quite a bit.
No, I meant like, I've literally, in marketing certain things, in biotech and in certain areas, like I was told I can't talk about certain things. So I'm saying, were there things like that in your world that you've experienced where it's just like, this is too disruptive. We can't tell people about this. Like, I mean, are aliens real? Right? I mean, You're not that far from Roswell in your career and things and so on and so forth. Like, did you get like the secret memo?
No, never saw a secret memo about that. But yeah, of course, there's things that are hard to talk about or disruptive that, you know, i.e. when I was married, I wouldn't go home and tell my wife that I just dealt with, you know, a father that, you know, killed his wife and 2 kids, you know. So certain things that you just very selective on what you talk about, you know, and that's why you I can't even talk.
Compartmentalize.
That's it. I don't know. I can't talk. Right?
Jesus, that's crazy.
What
saw that?
Advice do you have for people who might not know how to compartmentalize? Because you must have had to compartmentalize a lot in your life.
A lot, yes. So being, you know, the best thing now is, you know, growing up, my dad's been in law enforcement for over 50 years, is we didn't talk about it. But the biggest thing is your mental health is key. So being able to talk about it and express it, that's where, if I can go back in time, I would do better about being open and talking about certain things, because you suppress it for so long, it's going to come out in a negative manner, some form or some facet.
Did you know November is Men's Mental Health Awareness Month?
And no, I did not know that.
We finally got a month, guys.
It's awesome.
It's all about us.
But
Take that, wife.
And it comes down to your staff, whoever your bosses, to make sure you're getting the proper care.
Yeah.
It's getting better now, but you know, the cops now are softer than they were 10 years ago.
I don't know. They're still hardcore with me when they pull me over. So
these new generation aren't the same.
Well, you know, it's good that there's a men's health awareness and the ability to, even the fact that you're recognizing the way you could have been different 15 years ago and dealing with, you know, a case where is a family annihilator. Like, how do you just sit on that and never speak about that? Yeah.
You know, we talk about it at work, go back, you know, cops have a very dark sense of humor.
Yeah.
Like if you would hear some of the things we talk about, like in the briefing room or in the squad room, if you were like the normal public or somebody from the street would walk in and hear that, it would not go over so well.
I can imagine.
But it's just a dark humor, right? We joke about things shouldn't be joked about. That's how we dealt with it.
Yeah.
And we just went on, you know, because at the same time, you go deal with that, you have to go get ready to deal with something else. So you have to just block it out because you have 9 more hours left on your shift. So there's no matter what, you're like, hey, I got to put this away. I'll deal with it later.
Yeah.
How do you compartmentalize all that drama in photography?
There's no drama in photography. I have to compartmentalize you. That's something that I got to work on.
How do you give everyone at home advice on how to deal with that?
A partner that drives you crazy. Sometimes I just don't come to work, you know, and I
That's not true. He comes to work every single day.
Is there a peptide that helps with gray hairs?
There's a peptide that helps with hair, skin, and nails. So not
Okay.
necessarily with gray hair, but yeah, there's a peptide for hair that helps with regrowing hair. A couple of them.
So that way it's too late for you.
I'm
It's too late for you. There's no hope.
there's a asking for a friend who has a ton of gray hair and looks older than me, if they want to go back to a full black.
It's a diet. It's a diet.
It's just too much work.
Yeah.
You got to diet every week.
Yeah, to grow non.
You wear it well though. It looks good on you. The little Superman S curl he's got.
I don't even know when the curl happens. We just posted this other episode, and I look at the photo. I'm like, no one told me that I had like a Clark Kent curl thing happening in the photo.
Wear it proud, bro.
Looks good.
Yeah, it looks good.
So, I mean, something like men's national
Awareness.
Mental health awareness, yeah.
awareness. I wonder if there's going to be content related to peptides or testosterone or any of this kind of stuff that gets pushed out.
There
Or
could
is it
be-
just going to be like, go talk to someone?
Well, yeah, you're right. When we were in Vegas and they were talking on stage about the fact that there are peptides that can help with
cognitive, mental
mental health issues,
focus, things like that. Yeah, there's a lot of peptides that are amazing for that, for brain health, cognitive thinking, that are good for the nootropic effect.
Yes.
Make sure there's I've had stories. I have put up people on peptides and got them off their SSRIs and some of their other kind of medications that they had other issues with.
Yeah, we got to get the word out, and I think that's part of the marketing point that you were trying to make earlier. Is that it's just not out there enough, and I know we're at the beginning of this. We're at the inception of this whole peptide movement, which is good for you, right? Because you're starting a business, and where do you see this thing going? 2 years, 5 years?
In 2 to 5 years, I think right now they're not heavily regulated. That's why you see all these research chemical websites, things like that. I think in the next 2 to 5 years, these peptides are going to be heavily regulated, try to be heavily regulated by entities, and it's going to be, I would say they're going to try to stop people from getting it, because I think it's going to grow so fast that they're not going to be able to stop it. There's going to be a big push to, I guess, these big companies trying to monopolize it.
Mm.
And they're going, I don't think they're going to suppress. I don't think they can suppress it because it's already out there, right? A lot of people know about it. RFK, some of these higher ups in the government now are all about peptides. So of course, what are they going to do with anything? They're probably going to try to tax it, and like they do with everything else.
What peptides do you think RFK is on?
Oh, jeez, what isn't he on? He's definitely on methylene blue.
Yeah,
because there's videos of him taking it in the plane.
What's that?
It's helps with cognitive thinking, helps with mental focus, clarity. It's blue. It turns your piss fucking bright blue. It's kind of cool.
That's cool.
What was it originally for? Because it wasn't meant to be peptide.
No, it wasn't. It was designed for. I can't remember what else it was designed for. I'm drawing a blank on that. But it was designed they use it in the ERs for something, and I can't remember exactly what they use it for in the ERs. But it was an emergency medicine type medication.
And then someone was like, "Let me just take a droplet of this and see what happens to me." And then he's like, "My piss is blue, but I can focus." So I haven't tried that one yet.
I tried it. I liked it, but there's other things I liked better in the peptide realm.
Yeah. I guess in the world of disruption, there's no way that peptides aren't disruptive.
No.
Because once you discover peptides, you're just like, how did I live without these?
Yeah.
Right. And what is it? Only 5% of the population in the world knows about peptides right now?
I don't
Yeah.
know about the world, but the United States is only 4%.
Yeah.
How crazy
And
is
about
that?
half them, or about half that number is only taking them, right? People
I
may
think
know
it's
about
got to
it.
be less than half. Because, 130 million is or 330 million, right? In the United
Is the
States.
what?
The population?
340 million Americans?
Something like that. So,
So, and that's part of the issue right now, right? You have all these research chemical websites popping up for these retailers that don't give proper information, and that's the problem, right? You have these people
but
that
they're not even allowed to.
they're you're right, they're not allowed to. They're only allowed to say certain things, right? On a compliance standpoint.
I feel like there have to be entities that only do education, and there have to be entities that only provide the actual ability to buy it. And then for the people who need extra handholding, let me say that again. For the people who need extra handholding, there's got to be like a person that they can go talk to,
Right.
right? To walk them through everything and so on and so forth. I remember in just supplements, it's not that complicated. Take a protein shake.
Right.
Right. But sometimes people just need someone to show them, like an accountability partner, or look, take out the blender. There's so much water to put in, so on
Right.
and so forth. what do you think is like the hardest part of adopting a peptide, enhanced lifestyle?
People aren't used to reconstituting it, right? Because most of them come in lyolyzed powder. This is a powder, and they got to reconstitute with bacterial static water. So a lot of people are, I would say, ignorant to it. They just have no idea what they're doing.
Yeah.
And the idea of injecting yourself, that was like one of the biggest things I come across with people.
Yeah.
Is that they're so afraid, or they're like, "What do you want me to do with this? You want me to stick myself with this needle? Are you serious?" But in reality, it's not. To us, it's not that bad, right? Because we've been doing it. I've been doing it for years. I've been around it for years. So to me, it's not taboo. It's nothing. It's nothing new. So I try to explain it to them on a level to where they feel comfortable, show them how to do it, things like that. But that's the biggest thing, right? These people need to get comfortable with injecting themselves or stabbing themselves. Essentially with
that is another barrier to entry on this whole thing, right? At first, you have obviously the customer education piece. That's huge, right? We got to get over that hurdle. That's going to take a long time to get people comfortable with it. Then the next thing is, I got to stab myself twice a week.
Yeah,
for the rest of my life.
Or daily.
Or daily,
depending on
what the peptide is.
Yeah.
And, if there's, do you know of any in the near future if they're going to be able to be as efficacious a dose through the stomach?
There's oral peptides right now.
Yeah.
And in talking to some of my friends, there's studies going on that they're trying to create more oral peptides that are more bioavailability. Either going through the cheek or whatever it is, so people can have an oral peptide.
I think that would be a game changer as well.
If they can get the bioavailability up and the percentage up in these orals to in the 70s, 80s, then yeah, it's going to crush it. Because these people there's going to be no end. People are going to be like, I can take this orally and do it. It's going to be a game changer. But to get it to that point, I don't know what it's going to take.
I remember when I was learning about supplements, like tablets versus capsules versus powder and so on and so forth. One of my manufacturers sat me down and showed me like article after article after article about Centrum and where how a Centrum goes through your body and where it ends up.
Yeah.
It was like over 85% of the tablet just is in the sewer system because your body just can't absorb.
You can't break it down.
Metabolize it.
1,000 vitamins in whatever system that they're packing it into that one little tablet. And so no matter how it goes through your digestive tract, 5%, 10% is what is even broken off the tablet.
Yeah.
And then what percentage of that you actually absorb.
Mm-hmm.
But that's why they overload it with everything known to man in one tablet to try and figure out how to give you a chance to absorb some of it. But I mean, I think when they can get this type of solution in like a capsule format in a dose that's not take 12 capsules in one sitting.
And there's also some nasal sprays out there that work fairly well for bioavailability, but some of them like NAD nasal spray, I would never take an NAD nasal spray. Yeah. Bioavailability of it's not good. But other ones like C-Link, C-Max, oxytocin are very good with the nasal spray.
How are you with nasal sprays?
Not a fan. It's I usually take them if I'm congested or stuff like that, but it just burns. I'm not a fan of it. How about you?
I have allergies, so I've been taking nasal sprays pretty much my whole life. I've never taken a peptide nasal spray. I've done the what's it called when the strips that stick to the top of your mouth?
They're not the lodging. They're the
transdermal.
Yeah, the transdermal. It's almost like a transdermal. I forgot. I know what you're talking about. It's like a transdermal. It goes through the roof of your mouth. It absorbs through the roof of your mouth.
And it absorbs through your nasal system.
Yeah.
And so on and so forth. I remember when people started doing vitamins in like the Listerine strip things, and then all these studies came out where like when you take it into your stomach, nothing happens.
Yeah.
Right. Like this is just a waste. It's like a gimmick. But then I've now seen peptides that it's like a strip that you just put in the roof of your mouth and it just gets fully absorbed by your facial systems.
Even then, I'm still weird.
If Dave does that, it doesn't hurt him.
Right. Even then, I'm still weird about it. I've seen people that try to sell me on transdermal peptides on the skin. I'm like, how is that? How are you gonna put that on your skin? It's not absorbing. It's not doing anything. It's a gimmick.
Yeah. So,
but no, the ones on the roof, I believe I actually tried the PT-141 the other day that had it, and it actually worked fairly well.
So, what do you think women who want to look younger, feel younger, so on and so forth, what types of peptides do you think that they'd be most interested in?
Probably the nootropic ones, the GHKs, the skin, hair, nail stuff, some of the growth-inducing peptides. There's a wide array of them that could help female health. I have a lot of female patients that come to me for certain not issues, but they want to be a certain way, right? So some of it's like the copper peptides, they have the creams, the serums, and then the injectables, right? Depending on what they want to do.
So at what point do you feel like someone is old enough to take peptides?
I believe it's 18 or over. So, some people will say 21 and over. The government hasn't put a regulation on it. I think it's down to being smart, cautious, and understanding what you're putting in your body. Anybody under 18, I shouldn't be taking any kind of hormone or I don't think any kind of peptide, to be honest. Just to be on the safe side, because you're still growing, there's still a lot going on when you're not fully mature.
Yeah. But if you're at Ludwig's age, it's totally okay.
Absolutely.
35.
You have nothing to worry about, Ludwig.
If you're 35, you're totally okay.
I think anybody over 30 should be on hormone replacement. My thought process. Because you're dipping down so low and you honestly feel better and your quality of life.
Side, is there ever a point where you're too old to take peptides? Like if you're a man in your 70s?
Absolutely not.
You could just be like give me some testosterone.
Well, they're the fountain of youth. They'll help extend your life. They'll help with a lot of things. Keep you young. Keep you mobile, agile. Help with joint health. Everything. Keep muscle mass on, fat off, cognitive thinking, your brain functioning right. Just like the GLPs. The GLP-3, retatrutide. They're coming out saying, even on the other GLPs, they're saying it's help preventing Alzheimer's, Parkinson's, and these mental health and these other things. It's actually more beneficial, lowering your cholesterol. And
Can you
things
talk
like
about retatrutide? Because that's a new.
Retatrutide's a new GLP-3 that's not FDA approved yet, which hopefully should be. I've used it. I've had friends use it. I love it. I think it's amazing. My cholesterol's dropped. The overall health benefits of microdosing it over long periods of time is very beneficial. And since it's often doing the GLP-3, it's not causing some of the issues that like Ozempic or semaglutide cause with like the gastroparesis, things like that. The bone density, causing issues with the bone density, things like that. But a lot of people were having those issues just because they weren't eating on it, period.
And so what's the timeline for it to be approved, do you think?
4 to 5 months, from what I was told.
All right. So season 1, we launched this whole podcast. It was called Disruption Podcast. We were interviewing CEOs about how they were changing the game and everything that happens. But right around the end of the podcast, we would give them an opportunity to take over the interview seat. So, you have, some marketing geniuses sitting in front of you. What kind of questions would you want to ask us?
So when it comes to like marketing a new product or something that, i.e. peptides, what do you guys think is the best route to get it out there to where people are trying to, I guess, censor certain information? How do you fight against that?
Yeah, you got to grab a Canon camera and you just got to throw it in the trash. And then you open up your MacBook. And I think the most powerful community-driven messaging is to have some type of private community group, right? And you think about it, when a church comes together and they want to change something, they'll have like a committee and they'll have a group and they'll host events and people will come and people will learn about whatever the pothole is that the church wants to fix. But then it gets done, right? It takes a village, in my opinion, to support people that are going through disease or going through whatever that they're going through. And when you have like the auntie, the mom, the sister, the brother-in-law, like all these people involved in searching for research, they figure out how to help those people, right? I think if people don't want to know about peptides, there's nothing we can do about it.
Right. There's
just nothing. You just gotta accept that until something changes in mainstream media and people talk about it a certain way and people see more amazing transformations and benefits and so on and so forth, like it's impossible to convince someone to even enter the other side unless it's come through a referral or an in-person discussion. I think we have to create more thought leaders in the space that are openly talking about it. And these have to be people that are bulletproof. It can't be someone who was indicted at some point for doing something silly. It can't be someone who is at the same time like a pastor at a church and then, might be, polarizing in some of their viewpoints outside of this one concept of peptides.
Yeah.
But like, where do you even find the people?
Serena Williams, right? She's on the cover. She's on posters all over the country now, promoting GLP-1. I don't know what the brand is. I forget the name of it, but she's someone who I think is helping take this thing to the next level.
We got to call Katy Perry. Adele. What's the girl with the most amazing voice that has a talk show now?
Idol.
Kelly Clarkson. We got to get Kelly Clarkson to start a whole thought leadership thing on GLP-1.
Yeah,
Right.
I mean, helping to break
So
down.
do you think starting at GLP-1 is, I guess, a catalyst or a gateway into getting other peptides streamed?
I think so.
The whole idea here is that you have the power to live your best life,
Right.
right? You just have to choose to analyze and understand what cards you were dealt with when it comes to your genes, your lifestyle, your choices, so on and so forth. And then, I mean, anyone has the power to sleep more. Anyone has the power to eat healthier, right? But then there's certain areas where you just need help because your body wasn't made to continue to be active at a certain age
Right.
point if you don't start getting some medicinal help, right? So I think thought leaders have to get created and they have to get set up. I mean, I think you need to become a public figure talking about it because, I mean, how many people speak about this stuff as eloquently as he does?
Not a lot.
And
And it's
then
refreshing.
you have to have someone in your ear being like, that was too scientific. No one understands what you just said.
Right. And I try to break it down to a level that everybody can understand. And even sometimes I'm like, I go too far into that. Like some people are looking at me like, what was he saying?
Yeah. I mean, everyone that I talk to that's totally clueless about this topic, when I start talking about the needles and subdermal versus muscular and so on and so forth, like no one understands what any of that means.
Right.
And then as soon as I'm like, oh, you stab your shoulder. He's like,
Yeah.
oh, well, if my shoulder's strong, I'm not going to feel that, right?
And that's why I put it back to like, it's like a diet. It's like an insulin shot in your stomach. Everybody knows what an insulin shot is. So
It's not true, actually. How crazy is that? People do not know about insulin. Like my wife and I went through IVF, right? I'm pretty public about the whole IVF process and the journey. There were so many times I had to give my wife a needle, but like, if you haven't gone through it or seen someone go through it, it's totally a foreign concept.
Yeah. Yeah.
And I mean, if I had to take a stab at a guess, 15%, 20% of the population of the United States is fully aware of how these needles work and what is a tiny needle and what is that really going to feel like. I mean, diabetics, when you're in the middle of a dinner and you have to like, prick yourself, like people around you are like, what is this person doing?
right.
Oh my God, why is there blood on the table or what's going on? It's one droplet, right?
Yeah.
To put into that little test tube, right? To see what the glucose levels are and so on and so forth. But if you don't have an elderly person in your family that you've seen go through this or do any of that stuff, you're like totally clueless. I mean, the sad thing is like until we turn our 30s and now 40s, there's just certain things you're just not aware of. Right?
Yeah.
Like I could get out of this chair right now too fast and hurt myself.
Right.
Yeah.
You throw your back out.
Sleeping, you can wake up with an injury. Yeah.
I mean, my wife, she cracks up. I think she cracks up or she's mad at me. But like, I don't sit down the same way I used to. When I sit down, it's like timber, right? Like I'm just like falling until the couch.
You're making noises, taking your shoes off. I noticed that last night when I got back to the hotel. I was like leaning over like, ugh.
Yeah.
And I think once you become aware, like, okay, my body's not what it used to be. Maybe I should start looking into all these things, so on and so forth.
Yeah.
You then go to the guy at the gym that's got the great physique, who's just super nice, right? They smile back at you or wave back at you, or like, we're kind enough to be like, excuse me, when are you going to be done with those weights? Not like I'm here.
Yeah.
I need this machine, right? And that person that introduced you to some things, and then you open your eyes, but it's not an overnight decision.
No, yeah, no, and what we were talking about before with what's the timeline on getting this to critical mass here in the U.S. It's going to take a while, but I think it started with GLP-1s. I think that's going to be the gateway.
It's like talking about chocolate, right? You can go to the grocery store and at the register, there's stuff that takes no thought process.
Mm-hmm.
But like this type of life-changing stuff, you got to go to like a special church group first,
Right.
right? And then you got to buy the chocolate off the girl who carries it in her purse.
Well, people that's knowing just about general nutrition, it amazes me that no one counting calories or even knowing about general healthy nutrition facts.
I mean, bro, what did we expect was going to happen when they taught us about the food pyramid on all of our lives, right?
Yeah.
Like they started off telling you the wrong stuff.
Right.
And what was that about? Oh, well, farmers needed some money and this whole country was being run by farmers and so on and so forth, right?
Yeah, milk and cheese.
I mean,
dairy.
This next one's going to be a hot take, right? But I feel like in India, the reason we push vegetarianism so much was because it was the cheapest way to feed billions of people, right? Because it was impossible to kill all the cattle who were, handling the land, right? And helping people do the farming and what needed to happen. But when you look at the hierarchy of people in India, once you were at a certain level of wealth, no one cared if you're a vegetarian anymore, right? Because you could afford to get the cattle and whatever needed to happen. So like every member of a royalty clan had hunting seasons and so on and so forth. And then you look at the people that are in the poorest possible caste, like they would never touch meat. It just doesn't make any sense to them.
Right.
My wife's totally gonna yell at me about saying that one out loud, but I just think, I don't know. Critical mass is only gonna happen once something hits mainstream media.
Yeah.
And we're not getting regulated to the point of what you can or can't say. But we might have something up our sleeves to help that happen at some point.
Right.
And,
Yeah. Maybe some sort of a show on TV. Maybe. That might
Maybe.
But there's got to be other questions that you have for guys like us.
Yeah. Knowing you and being in the space, the nutrition space or the supplement space, from the supplement space to, I guess, the hormone space to the peptide space, what do you think what do you see the biggest differences, right? Because there's so many different manufacturers for these products now for,
Yeah.
You know what I'm talking about. What is it? I was with you at Supply last week, right?
Yeah. I mean, when it comes to,
It baffled me that there was so many distributors for the same type of products to get it out in the world. I'm like, why wouldn't there be like 3 or 4? But there was thousands of these people that were selling the same products.
yeah, nutraceuticals has truly exploded, right? And I think it's not going to be any different for peptides once it's openly something that distributors can talk about and there can be open competition. I think the biggest difference between the 3 verticals that you mentioned, right? The hormones, the peptides, what was the third one?
The supplement, like, yeah, nootropics, you know.
I think the biggest difference is that the demand for these 3 are so drastically different versus the need for the 3 are so drastically different. So it's like the commercialization that has been allowed to happen because of the demand is what drives expos, athletes that talk about it openly.
Right.
Tens of thousands of brands. I think it's over, there's 1.4 million brands or 1.5 million brands on Amazon.
Jesus.
Nutraceuticals right now. There's on Amazon.com.
It's crazy.
That's insane when you think about it out loud.
The thing that cracks me up about it is these products like B12 gummies, stuff like that. We know they don't work.
So there are some gummies that, in my opinion, are a catalyst to certain things to happen in your body, right? The definition of work is like, we know this isn't going to actually be a lifestyle change, right? Is it a positive progression, whether it's a baby step or whatever? Sure.
Right.
I mean, in any fitness regime, you got to get over that thing like, oh, if I take protein, I'm going to look like Joey Swole, right? Like one protein shake is not going to magically change you to having ripped arms or whatever else needs to happen.
Right.
And so I'm actually all for people taking baby steps, right, to get to where it needed to be. I mean, getting this guy to take a needle, it must have been a journey.
Yeah. Oh, yeah.
We're just going to say yes on the first time someone was like, stab yourself.
Yeah, no, never did it before, never had to. So it's a thing.
Bro, if made up money like crypto could get to critical mass, to where it is now, where everyone's got a crypto
Yeah,
wallet.
and what was the timeline on that, right? 15 years maybe? 2010?
Yeah.
Crypto?
I mean, what year is it now? 2025?
Yeah, it's about.
It came out in 2009?
Yeah, something like that.
Like 2008 is when Satoshi came out. So I'd say 2011, 2012 was when the first person brought Bitcoin to me.
Right.
And I'm like, you're out of your mind if you think I'm giving you $3,000.
And that doesn't involve
for
you
this.
sticking yourself with a needle to get crypto, right?
This is monetary.
I mean, my body and
That's
my
been
wallet are kind of equally important to me. And so I don't think I took it seriously for 5 more years. It wasn't until 2016 where I'm like, I wish I gave that guy $3,000.
Right.
I messed up.
When it was at $100 or whatever it was, or $3,000 in 2017, whatever
I
it was.
think whatever the price was at that point, I was like, I missed out now. This is never going to turn into what it is now. But if people feel that way about peptides or hormone replacement 10, 15 years down or 5 years down the road from now for wherever it's going to go, I mean, at some point, you just give in, right? Now people are buying it at $130,000 per Bitcoin. And now it's not even like, oh, I missed out on owning a whole Bitcoin. It's like I have to take part of this because if I don't, I'm going to be left behind.
Yeah. And that's going to be the way with GLP-1s, with testosterone. I believe that.
I think the hormones are getting better now. Even in the 3 years I've been, 3-4 years I've been in this hormone space, the change in the 3 years, 4 years is huge.
Yeah.
So people are actually talking about it openly now. It's not as taboo, which is nice. You know, you go to the gym, we walk around, and people, I even, for the last 10 years, I was open about being on testosterone. I have nothing to hide. People are like, why are you telling people that? I'm like, I have zero shame. I don't care. I'll tell people testosterone. It's helping me. It's making me do amazing things. Why wouldn't I want to spread that out to somebody else?
I mean, my boy Henry and I were at this networking event in Vegas for supply side, which is where all the ingredient suppliers and all the guys who are literally in the industry, in the space. And it was a 5 a.m. workout, networking event. We roll up. Our boy Dave comes in with some needles. And we're like, all right, perfect. Let's just do it right here in the middle of the gym entrance. Because, like, we're not doing anything wrong.
Right.
But, bro, the looks we were getting from people who are literally in the health and fitness industry in the space.
Yeah. And all it was NAD and glutathione.
And it wasn't like we're, like, taking, like, steroids to, like, before we hit a pump. Like, we were taking stuff for immunity boosting, right? And stuff that keeps his beautiful face beautiful all the time.
Yeah.
Bro, but the looks that people were giving us. And then, but there were, like, a handful of people that were jealous. They're like, oh, I wish we had that. I wish we had a Dave that would come bring us needles. And honestly, well, I don't think we're too far, man. I think you're doing everything right now with the content and being open to becoming a thought leader in the space. I think it's brave.
Absolutely. And once we add a few more popular faces to this movement, no
other popular faces, just Dave.
Just Dave.
Just Dave.
Yeah, no one else.
Just Dave and maybe one 50-year-old superstar like a Tom Brady that talks about, at some point.
That boy is definitely on peptides.
Oh, he's on something.
He's definitely on peptides.
You know what I'm saying? Or
The
The
thing
Rock.
Talks
Is
The
about
Rock or some of these stars, some of these high influential people, we know they're all taking.
And they're not talking about it. That's the whole point. They're not talking about it. They're
doing,
denying it.
I guarantee a majority of these people are on some kind of peptide regimen. I know there's plenty of doctors in Beverly Hills that are selling these peptide protocols for tens of thousands of dollars, which I've seen some of these invoices for these peptides.
What would that same protocol be from you?
$1,000, $2,000 for then some of these doctors are like $15,000.
Joe, Mr. Rogan, all right? Joe Rogan, if you're watching this, stop paying $20,000 for your protocol. Please call Dave. Dave will save you so much money.
I'll help you out. Give you whatever you need.
All right, Ludwig. I mean, Dave, it's been a pleasure having you on this episode.
Thank you, guys.
I can't wait to see where the season goes. I can't wait to see where your businesses go. Ludwig, take it home.
Appreciate you coming on the podcast with us, man. And this has been another episode of Disruption Podcast. We'll see you next time.